All right, so thank you for the global tallies. And while we wait for her to get seated, I'm going to turn to our SHIN YE-EUN for a detailed coverage of the local Omicron situation. Ye-eun, welcome back.
Thanks for having me, Sunny.
Right, so Ye-eun, the million-dollar question that is now in the focus is when will Korea's Omicron reach its peak, right?
Right, a lot of people are very curious about that, but we haven't heard anything official from the authorities yet. All we heard from the KDCA is that we could see up to 170,000 infections per day by the end of this month. Already, we've seen the number of new infections rise 70% from the tally reported last Thursday. Compared to 2 weeks ago, today's figure represents a fourfold increase. One health expert analyzing data from the National Institute for Mathematical Sciences said Korea's Omicron peak could be in mid-March. The expert analyzed our current COVID-19 trend and said we may see up to 270,000 daily infections before cases start tapering off. And meanwhile, other health experts weren't too sure how high the figure could rise to at the peak of the wave. But one thing they were sure about is that the numbers may continue to rise for now.
Because we're using rapid antigen tests, we may be seeing smaller COVID-19 case counts than the number of people actually infected. Keeping this factor in mind, we may soon witness between 150,000 and 200,000 daily infections.
I still have high hopes that the peak will occur sometime today. And from early parts of this weekend on, I'm still hoping to see that the numbers will start to go down in a drastic fashion. But in my current personal point of view, we still have to wait and observe for another couple days or so to really discern whether or not the curve will change its course.
And now, given the latest developments, Ye-eun, what are authorities saying about their planned ease in social restrictions?
Well, first off, the government has said it will introduce new changes to social distancing measures to minimize the damage to the economy and society as a whole. Health authorities are likely to raise the cap on private gatherings to 8 people from the current 6 and allow restaurant and cafes to stay open an hour longer until 10 p.m. But some experts say now is not the time to ease measures given that Omicron is spreading like wildfire.
We just started our 4th dose booster campaign in the vulnerable groups. I don't want to make the same mistake as we did when we initially launched our Living with COVID scheme back in November of 2021, when we did not wait until our seniors received their 3rd dose booster before we opened up society.
Another medical expert agreed that a premature easing of restrictions could have serious consequences.
I don't understand. We're in a very dangerous situation and essential societal functions could become paralyzed if we loosen the social distancing rules right now.
And one expert added that if the government does ease social distancing measures, they should do the same for vaccine passes. Earlier this week, senior health officials Hon Young-rae said that vaccine passes are still required to protect the unvaccinated. But this expert said vaccine passes aren't as effective in preventing transmission when it comes to the Omicron variant.
Right now, social distancing measures or vaccine passes are not really helping in preventing the spread of infections. Because Omicron is so transmissible, whether we ease measures or ease vaccine pass rules, it's not going to really change people moving around.
And in regards to social distancing measures, there are also voices of concerns coming from essential workers, such as medical workers, police officers, and firefighters, as they are not being spared by the fast-spreading Omicron variant either. Cluster infections at hospitals have led to surgeries being canceled due to doctors and nurses in quarantine. At one university hospital in the capital region, a total of some 40 medical workers, including 17 doctors, were in quarantine as of Wednesday. Another hospital had some 50 medical staff testing positive this week. A cluster infection involving 19 COVID-19 patients at a police station in the city of Incheon led to a temporary suspension of operations there, as more than half of its 35 police officers have been infected. The station has reopened since, but as you can imagine, workloads have pretty much doubled. 59 out of 250 police stations nationwide have reported COVID-19 cases, and as police officers and firefighters have to work in shifts 24 hours a day, there are concerns that the rising Omicron infections can lead to serious disruptions.
Right, and those are, of course, very valid concerns. Meanwhile, Yeun, I hear recommendations for COVID-19 testings within the academic arena are being met with a bit of opposition.
That's right. As Soa said on Wednesday, Education Minister Yoon-hae promised to hand out more than 60 million rapid antigen test kits to all students and staff from kindergartens to high school free of charge. The ministry recommended all students test themselves twice a week, preferably on Sunday and Wednesday nights. All staff are being asked to test themselves on a weekly basis before Monday. By using a mobile app, they can also share their test results with their respective schools. While these guidelines aren't mandatory, which means students and teachers won't be punished for going to school untested, they've stirred up much controversy. As of noon Thursday, more than 80,000 people have signed a petition on the Blue House website against the use of self-test kits at kindergartens and elementary schools. And their concern was that this measure would make testing students with no symptoms become the norm. Meanwhile, some parents said they were relieved, believing many students will get tested on their own accord before attending school.